Medical news from Journal of Clinical Oncology, official journal of the American Society of Clinical Oncology. Safety and clinical outcomes of pooled donor, non-engrafting expanded progenitor cells in single-unit cord blood transplantation. The addition of dilanubicel, a cryopreserved, cord blood-derived expanded progenitor cell product generated from pooled donors, to a single-unit cord blood transplant, CBT, appears to accelerate hematopoietic recovery without increasing severe graft versus host disease, GVHD, offering a potentially safer and more efficient alternative to the current practice of double-unit grafts. In a Phase 2 trial of 28 patients with hematologic malignancies, all participants achieved neutrophil and platelet engraftment, and 27 remain alive and disease-free after a median follow-up of 1.4 years, suggesting that the strategy may improve early post-transplant outcomes while preserving long-term disease control. Cord blood transplantation is an established curative option for many high-risk leukemias and other hematologic cancers, yet its broader use is hampered by the relatively low cell dose of a single cord unit, which leads to delayed neutrophil and platelet recovery and a higher reliance on double-unit grafts. Double-unit CBT, while improving cell dose, introduces additional immunologic complexity, increases the risk of severe acute GVHD, and adds logistical challenges. Prior attempts to augment single-unit CBT with ex vivo expanded progenitor cells have shown promise but have been limited by safety concerns, especially the potential for heightened alloreactivity and GVHD. The present study was therefore designed to test whether a non-HLA-matched, pooled donor expanded product, dilanubicel, could safely boost engraftment kinetics when combined with a single cord unit, thereby reducing the need for double-unit transplants. In this single-center, open-label Phase 2 trial conducted from March 2022 to July 2025, adult and adolescent patients, median age 36 years, range 10 to 63, with acute leukemias, N equals 25, or other hematologic malignancies, N equals 3, received a matched single cord blood unit followed by an infusion of dilanubicel targeting a dose of 800 × 10 CD34 cells. The study protocol mandated that the expanded product be administered after the cord unit infusion, allowing for assessment of its contribution to early hematopoiesis. Engraftment was monitored through serial peripheral blood counts, flow cytometry, and chimerism analyses. For comparative context, outcomes were juxtaposed with a contemporaneous institutional cohort that underwent standard single or double-unit CBT without dilanubicel. All 28 participants achieved neutrophil engraftment, median day 18, range 14 to 30, and platelet engraftment, median day 31, range 26 to 43. Dilanubicel induced a transient wave of myelomonocytic cells that peaked on day 7 and resolved by day 14, while an early lymphocyte expansion, originating exclusively from the cord unit, was evident by day 9 and peaked on day 11. Importantly, no grade 3 or 4 acute GVHD or chronic GVHD was observed in the dilanubicel cohort. When compared with the institutional control group, the dilanubicel-augmented transplants demonstrated significantly faster neutrophil recovery, median 18 days versus 24 days, p less than 0.01, and platelet recovery, median 31 days versus 38 days, p less than 0.01, as well as a markedly lower incidence of severe acute GVHD, 0% versus 12%, p equals 0.04. At 1.4 years median follow-up, 27 of the 28 patients remained alive and free of disease relapse, yielding an overall survival of 96% and a disease-free survival of 93% in this small cohort. Subgroup analysis revealed that the accelerated engraftment and low GVHD rates were consistent across age groups and disease subtypes, with no apparent difference between acute lymphoblastic and myeloid leukemias. The transient myelomonocytic surge from dilanubicel did not translate into increased inflammatory complications, and the early lymphocyte expansion correlated with robust donor chimerism, suggesting that the expanded product may provide a bridge to durable hematopoiesis without provoking alloimmune injury. These findings suggest that incorporating dilanubicel into single-unit CBT can safely shorten the period of neutropenia and thrombocytopenia, potentially reducing infection-related morbidity, transfusion requirements, and hospital length of stay. The absence of severe GVHD challenges the prevailing notion that non-HLA-matched expanded products inevitably heighten alloreactivity, and may prompt a re-evaluation of current transplant guidelines that favor double-unit grafts for adult recipients. If confirmed in larger, randomized trials, this approach could expand the applicability of cord blood as a readily available, off-the-shelf graft source for a broader patient. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.